EWMA is proud to present the new and exciting document on atypical wounds, best clinical practices and challenges.
This is an interdisciplinary document aimed at carers, clinicians and educators in all fields in wound management to help in the diagnosis of atypical wounds.
Unfortunately, there is often a considerable delay in diagnosing these atypical wounds when the wound is not classified as venous, arterial, mixed venous arterial, a pressure ulcer or a diabetic ulcer. And also, if the wound does not heal within 4 to 12 weeks, then you should suspect an atypical wound and take a biopsy.
My chapter was about Pyoderma gangrenosum. The message is you have to think about what to do, and I believe that biopsy is one part of the diagnosis in rare diseases. And don't wait if you have an inflammatory looking ulcer. Don't wait too long. Do the biopsy as early as possible.
I was invited to write about Martorell hypertensive ischemic leg ulcer, let's call that hypertensive ulcers, and also calciphylaxis, which is actually the same disease in patients who have kidney disease. Caregivers will be able to download for free all these information that are hands-on information, but that are scientifically based. There is no confounding, no commercial bias. It's just the opinion of these experts who have treated hundreds of patients there on their own.
So my chapter in the document was on malignant wounds, tumor wounds. 2 to 4% of all wounds are because of ulcerating tumors, and it's important to recognize these wounds as tumor wounds because the treatment is completely different.
We also have a practical aspect chapter in the document that will give some help to the clinicians in everyday care decision making, and we have an algorithm to aid the clinicians.
So we also have a chapter on the patient perspective. This includes the psychological impact of living with an atypical wound for patients out there.
The chapter that I have written is called Health, Economy and Organisation. So generally I was looking at the cost of atypical wounds, and what I found looking at the literature, there's not a lot of literature on atypical wounds because there's such varied etiologies, and they're chronic wounds and often incorporated in leg ulcer data, and often because of the delay in diagnosis, the cost was limited in finding that sort of information out. The message in the chapter is sort of early diagnosis and referring when the wounds are progressing, just so those can be treated accordingly and the correct diagnosis occurs.
You can download it for free on the EWMA website, and we hope that you will use it in your everyday practice.
I think everybody who is caring and treating chronic wounds should read this document.
Finally, we are really grateful and thankful for the fantastic author group, for EWMA and for the sponsors, Polymen and SCT, for making this possible.